Hello, everyone. Welcome back to another amazing episode of 52 Authors, 52 Weeks. And as you all know, the purpose of this video podcast is to celebrate unique voices, insights, and contributions from authors from a diverse range of genres and expertise. Each and every week, we spotlight one remarkable author and their work. And I am so excited about today's author. And I know you probably say, she's excited every week, right? I'm just excited about living. But it is always a good time for me when I can sit down with a physician. Many of you know I've been in healthcare for 32 years, started off as a medical assistant, working side by side with physicians. Today, I do some things with physicians, not as much as I used to, but I am excited to welcome to our show Dr. Tony Hampton, who is from here in the Chicagoland area, who is an accomplished physician, speaker, podcast, author, who, from my research, is really dedicated to transforming our lives through health and nutrition. And he's also quite the advocate from a healthcare perspective. Now, just like I always do when we have physicians on the show, Dr. Hampton is not your physician. He is not here to deliver any type of medical advice, but I will tell you, when I read the book, let me just make sure everybody can see it. The title is Fix Your Diet, Fix Your Diabetes. And then I added Fix Your Life because I, as a researcher, did a bit of a research on diabetes. Like, I knew these things, but just looking at the CDC, the Centers for Disease Control website, the statistics for diabetes, I had two reactions. One, I said, wow. Two, I said, because for the last 32 years, I've been involved with professionals that collect the diagnosis code. So like when a patient is seen in the clinic and the patient has diabetes type 1, type 2, we capture the numbers, right? But how often are those numbers not accurate, not captured? You know, sometimes I see the patient is listed as pre-diabetic. Sometimes I see that one visit, they're diabetes type 2. The next visit, they're type 1. The next visit, they're type 2. And I'm like, whoa, something is wrong with this data. So I have seen over the years diabetes documented and diagnosed and patients getting educated on it. As a healthcare professional, I'm always monitoring my blood sugar levels to make sure that I don't tip over that number. That's the big thing, right? When you see the commercials about Wegovy and Ozempic, oh, it's for weight loss, it's for diabetes, it's all this information that's floating around. And I think it has many people a tad bit confused. As a person who has been larger than everybody else throughout my entire life, weight is something that I'm constantly monitoring and top of mind. But enough about that. Let me allow Dr. Hampton an opportunity to introduce himself formally and tell us more about the work that he does.
Well, I really appreciate this, Dr. Lisa. Just an opportunity to get in front of more people to share my perspective. I am on the south side of Chicago. I've been, I grew up on the west side, just throwing that out there too.
Oh,
I throw that
no.
in there. Right. I try not to wear my west side hat when I'm on the south side. I love all of the city. Um, I became a family doctor because I wanted to kind of do that, Marcus Welby, know-it-all kind of doctor, can answer any questions. I love that approach. In my training, though, I learned that many of my patients weren't healing as much as I'd like. I had them on a lot of medicines. They weren't getting better. So I said, well, why is that? And then I said, well, let me learn more about obesity medicine since that's you kind of echoed that a little bit. And I became board certified in obesity medicine. But even in that training, I learned that it was still medicine centric, procedure centric, and I wanted more. And I also knew, and I'm sure you had the same experience, that we didn't learn a lot about nutrition. I felt like the obesity story and the diabetes story had a lot to do with nutrition. So I got a master's in nutrition and functional medicine. The functional medicine is more about the root cause of why we get sick. So my focus now in my clinic, no matter what people come in for, whether it's diabetes or any other condition, is to say, well, why did you get diabetes? Well, why did you have this high blood pressure? And so my angle for my patients is to help them ask that why, answer that why question. And we have a lot of tools at our disposal. You kind of echo the importance of measuring things. And one of the tips I'll give your audience is one of the best tools to know where you're going, right? Not just your family history, but if you get a fasting insulin level, you can predict diabetes and many other metabolic diseases 5 to 10 years in advance because your body is magnificently made, and your body's able to keep that blood sugar normal and your A1C, that 3-month test, normal for years. But that insulin level needs to go up to keep that in check. So if you have never gotten a fasting insulin level, get that. And if you have a high number, it means that you may be heading towards diabetes. You also may be insulin resistant. And because of the hormones that will hurt you, chronically high insulin level is the one that is the best predictor. And if you can get that number down with your diet, with your lifestyle, that's going to be the key. So that's kind of the message I want people to heal. I do not want to be a manager of disease. I want to be a healer and someone who helps people to get off medicine and in many cases, and also just reverse or let's use a safer term, put it into remission. Because if you stop doing the things that got it into remission, it's coming right back. So remission may be a safer term, although my book says my dietary solution to reversing. I think ultimately you're going to get it again if you go back on those diets that lead to high blood sugars.
Wow. There's a couple of things that really popped out for me. So, number one, growing up in the Chicago public school system, I'll be honest, I have always been a leader. So, I got out of gym by taking attendance for my instructor. I will never forget him because our birthday was on the same day. And I did this for 3 of the 4 years. So, there wasn't a value placed on being active and exercising, right?
Mhm,
In my family, nutrition was important, but not the exercise part.
mhm.
And I know today that they go hand in hand. So that's number one. Number two, this episode is going to air right before Christmas. And I think that's a perfect opportunity for all of our listeners to have the conversations with your family. Like, what is in your bloodlines? There's so much that we don't know about our family. And that's the perfect opportunity to find out the things. So, like, I am unfortunately the patient that goes to the doctor and knows all about my family history on both sides. And it's not to be like, trying to take over the visit or be cocky. It's really about me trying to manage or prevent things that I know that are in my history. I have a family history of lymphedema, right? So
Right.
at 50, I went to the doctor and was like, hey, I need to be worked up for lymphedema. I wound up going to therapy for lymphedema. Now I have compression pants and socks. And somebody's like, at 50? I said, have you ever seen pictures of lymphedema stage 2, 3, 4, 5? Have you ever seen those pictures? As a professional speaker, a healthcare professional, I want to manage my condition and not let it manage me. And
Yeah.
so, the very first part of your book, you talked about mindset. And I think that
Mhm.
plays a huge role in how we think about our health in general. And the last point I'll make, when I was going to medical assisting school back in 1992, which seemed like so long ago, but I learned all these medications. And then when I would
Yeah.
intake patients and I was writing down the medications, something that I noticed that some patients had a longer list of medications than others. And I think part of it is lifestyle, it's mindset, it's upbringing. And I think those are the conversations that we don't have that we need to have, right? When somebody gets on Ozempic or Wegovy, everybody's like, whoa, you look great. Well, what happened to when you saw someone who was getting more weight on their body? What about, hey, I go to water aerobics or I do this, I do that. You want to join me, right? To help guide them into the other direction, but we just kind of wait until the weight is coming off and it's clap your hands. But wait a minute. Wegovy, Ozempic, all those medications are for a lifetime.
That's
But exercising and eating right is also for a lifetime. So which path do you want to go down?
That's it. Everything you're saying resonates with me. In fact, when I think about Dr. Lisa worrying about lymphedema, and it seems premature, but even people who have had surgery for breast cancer, their risk for lymphedema in their arms are high. And most patients don't know that if you do some compression and some physical therapy before it even gets to you, you can actually prevent it as opposed, and you rarely see an oncologist or a primary care doctor suggesting something like that. You can actually prevent it if you just get ahead of it. And I did start my book focused on diabetes, talking about the first chapter, I think, was about motivation. And why did I start that? Because I think if we can have a personal and emotional, unwavering reason to do what we're doing, I think we're going to do much better in life. So it's really about, showing up for yourself. It's about, I think about your why. I had a patient recently who, kind of was on this diabetes journey. She had been on insulin for 11 years, and she met me, and I told her about low carb and things like that, keto. And she really wasn't that motivated until she bumped her head. She was a medical assistant. She bumped her head at work. She did an MRI. She's only in her 50s, and she had evidence of microvascular disease in her brain. And she knew enough about that to say, this could be a stroke down the road. This could be dementia down the road. In that moment, she changed, and she got on a dietary pattern where she reduced the carbs, and she was off insulin. She had been told she'd be on insulin for the rest of her life. She got off insulin in 45 days by simply stop consuming the foods that spike her sugar. And so this is really not about just appearance. We all want to look good. It's not about just getting the right A1C. It's about how long am I going to be here for my family? Am I going to be able to not live in pain and have a quality life and not have all those complications of diabetes? So, and then I think the second chapter talked about the belief systems we have, right? And so many of us have self-limiting beliefs, right? And we need to, start to question that, right? I can't give up bread. I've always liked bread. They say things like that. If diabetes is in my family, everybody's going to get diabetes. They say things like that. Or even the idea that the diet I'm recommending, which tends to be low carb, is dangerous, right? So they have all these beliefs, and I try to shift that to one where, yes, I'm capable of healing. I can put this into remission. I can make choices that impact my outcome. And what happens is when I give them examples of like that patient I just shared, they're saying, well, if she can do it, why can't I do it? So it's really about shifting from self-limiting beliefs, being motivated, understanding your why. And if you do all of those things, you will accomplish great things. And the last thing I'll say is this: many of us have goals in life, and we can, if I ask a person, what's important to you, they'll give you an answer many times. But the question is, what are you doing to achieve the things that are important to you? So if you say family is important to you, how much time are you spending focused on your family as opposed to that job? And a lot of times there's a disconnect between what you say is important and what you're doing. So another message for me today is, if you have defined your goals in life, please, please, please spend every single day trying to achieve that. You will find yourself far ahead of everybody else because most people are distracted by the noise. Focus on what's important. For me, part of what's important, which is why it's easy to be in front of you, Dr. Lisa, I'm trying to teach the world how to achieve metabolic health. So if I'm able to do that on my YouTube channel, on a podcast, or on your platform, I'm living my purpose. So when I finish, so as I start the rest of my day, we're recording in the morning. I feel, well, I've done what I've needed to do to fulfill my purpose. Now I can go and deal with the other stuff that's important as well. So I just really think everybody should do that, particularly as we start a new year and we're thinking about reflecting on the year and thinking about the future. Let's get focused, and you don't have to do but 5 or 10 minutes a day, but that'll add up over the year.
I love it. So I want to read something from your book. There's two reasons why, but the first is excuses are tools of incompetence used to build monuments of nothing. For those who specialize in them shall never be good at anything. So that caught my eye for two reasons. Number one, as a member of the Divine Nine,
That's
that
what's
caught
up.
my
That's
eye,
what's
that
up.
first sentence. So, but we have excuses about everything, why we
Mhm.
can't do something. I mean, when I think about the conversations that I listen to there's always an excuse about why something didn't get done. And I know I'm a witness. I am living my own testimony that if you set your mind to something, you can make it happen, right? I think about this is the end of 2024. You are episode 51 of 52. And
Mm,
over a year ago, when I had the vision to start this podcast, 52 authors, 52 weeks, I just kept putting in the work.
mm,
And if you put in the work to the things that you value, you can make them happen. Will it be easy? No, nothing is
mm,
ever easy, but will it be worth it? Absolutely. I have personally had an opportunity to sit down with 52 people from
mm,
across the country that I would have never met except via this platform.
mm,
And so I'm excited about 52 Authors, 52 Weeks 2025 version because I have this vision of meeting some real heavy hitters. There's one physician who I am ready to have a conversation with. Just recently wrote a book about racism in medicine, Dr.
mm,
Uche Blackstock.
mm,
Definitely enjoy reading that book.
mm,
And my mindset has really shifted, but also to some extent, a little overwhelmed as I think about, as I end the tail end of this fracture that I've been enjoying. And I'll say enjoying, right? Because I spent time, for those of you who don't know, September 8th, I fell and fractured my ankle. I had
mm,
surgery. And so I was confined to my bedroom. And so my reading was on next level, right? Because I was in the room reading, writing, crying, praying, right? But I realized that I was being set down for a reason.
mm,
In fact, in my next book that's coming out, I talk about how my surgical experience was like a ECMO experience,
mm,
extracorporeal membrane oxygenation, where I had to sit down for that time period to really see that I needed to rest. And not
mm,
just go to sleep, but also rest, but also reset and think about on the other side of this, what's next for Lisa, right? What am I going to stop doing?
mm,
What will I start doing? During the surgical experience, I ordered meal prep, and that taught me something. If you, I knew about meal prep, right? But it's not until you're forced to do something
mhm,
that it really hits you. I'm like, wait a minute. If the meals are already prepared, the right portion size, the right, amount of food items on the plate, you'll do better. And the week that the meal prep was canceled for Thanksgiving, I was like, whoa, what am I going to eat? But now I realize that concept is something that we can do. I just got to get my husband on board
Ah,
with being on one accord about the meal prep. But I realize it's something that's needed for life, not just during a 90-day surgical experience, but for life. Because I want to see my grandchildren grow up and be, you know, productive young men. And I can't do
right.
that if my legs are too big for me to
That's
walk
right.
around,
That's
right?
right.
All
That's
those
right.
things. So I have to be proactive. My mindset has to be right, but I have to limit the excuses.
Yeah, well, I love the concept because I meet people where they are. So, and meeting people where they are is accepting that if I have a person who has just fractured something, it may be more challenging for them to achieve their health-related goals in that moment of fracture, in that moment of stress. So, but the goal is not really about excuses being they're kind of like problems to solve, right? So if I have a problem to solve, which is what you did, you solved the problem by saying I need to be able to feed myself, but I can't stand up next to that oven right now because I'm fractured. And you instead of having an excuse, you found a different path. So many people who hear this episode need to understand there's always a way to solve a problem. And yes, if I'm a busy person, meal prep may be a great idea if my budget allows and they can give me the kind of meals that I can eat. And when I was in my obesity training and became board certified, meal prep was one of the top 2 or 3 ways that people lost weight because it's easy. And we have to be honest about that. But we don't want to have excuses because excuses, they block progress. They're like these roadblocks that you create in your brain. They also give you an excuse to not do anything, ironically. So if I have an excuse, I can say, well, hey, I don't have to do this because I have a reason. I'm supposed to struggle right now, and I've just fractured something. But no, it's a problem. And it also, what I don't like about excuses is that your brain, what you focus on grows. So if you focus on the problem, you won't focus on the solution. So I think it's really important that we not focus on problems. We have to address the problem. We have to address the excuse, but we don't want to just focus on that because I want to maintain my power. I want to be empowered to impact those barriers in a way that really help me to overcome them. And part of that is going back to those earlier chapters. You got to remove those self-limiting beliefs. And once you remove those self-limiting beliefs, you won't delay action because you know that there is a path to a better place than where you are. And when you do that, you won't have regrets because so many times we'll end up in a situation like you ended up, Doc, and we'll not utilize that time properly. It sounds like you actually took that and turned it into a win. You used it. I mean, I wish I had time to, read more. And most of my reading is an audio book because I'm doing that on the way. I'm coming from the west suburb, outside of Chicago to the south side of Chicago. It's going to take me 30, 40, and sometimes an hour and 15 minutes on a Friday. So I use that time to, fill my brain with audiobooks. And I just think that there are no excuses. I can't say there's no time to do the things I want to do because we have to prioritize our goals and make time. So I just think, please, guys, do not let your life become a life of excuses. There are plenty of people who look like you, who have the same resources as you, who have accomplished phenomenal things. I think about where I grew up on the west side of Chicago in what we call K-Town. Uh,
Oh,
and amen, and it was crazy back then. It's crazier now. And I'm an outlier, but I don't want to live in a world where the kid on the west side of Chicago in K-Town, Garfield Park, and on the south side, Inglewood, et cetera, are not given opportunities. So I'm all about making sure they have the knowledge of what's possible so they can see somebody that looks like them. And then let's walk together to figure out how to get them to a better place. So we don't have time for excuses. So it's a great concept to share.
I love that. And the last point I want to call out, because this is just something that has been in my spirit for a couple of years. So, first of all, I released my first book last year, and chapter 12 was about faith over fear.
Mm,
And then in your book, you talk about why fear is the number one reason beliefs aren't challenged. And you say fear is false evidence appearing real, false evidence appearing real. And when I read this, I got a little emotional because once I had surgery for 6 weeks, I was in a non weight bearing status, right? And so
mm,
I was hopping from my bed to the bathroom, which I'm blessed that it's not that far away. But at first, mentally, I kept saying, I'm gonna fall. I'm gonna
mm,
fall. There
mhm,
was this fear that I was going to fall and
mm,
either fracture something else. And so I had to say to myself, every time I moved, you are not going to fall. You are
mm,
not going to fall. And I have
mhm,
not
mm,
fallen
mm,
because I kept telling myself I wasn't going to fall. And so I think a lot of times we allow fear to hold us hostage.
mm,
And I want to challenge everyone to have that faith over fear by just building some small, tiny habits. Because they say it takes 30 days, right, to build a new
that's
habit.
right.
Well, let
That's
me
right.
just tell you, after being in the bedroom for 90 days, well, minus this previous week where I did have an opportunity to go to Jamaica with some mobility aids, right? But I needed that opportunity to go to a place that I love and also allow my caregiver, my husband, an opportunity to rest because he had
Mhm.
been waiting on me hand and foot for the last 90 days. And so I was a little afraid to get on the plane, right? Because there's the thought of the blood clots, right? So I talked to my
Mhm.
surgeon about taking aspirin, right? So being proactive. But I had to not allow my situation to hold me back from it within reason, right? It wasn't like I was trying to go week 2 post-op, right? I was at the tail end, but I had to take this trip, take this step, this one thing for me. And so when I think about little tiny habits that we can do, you talk about so many of them in the book to the extent that I'm just going to put this out there. I would like to see some mini modules, some classes on these chapters because I think some people need to see it, but they need to hear you
Mhm.
tell us to replace the processed foods with, right? We need to hear that. And when I
That's
think
right.
about the food that I eat when I travel, it's different because it doesn't have all the processed things in it. And
Hmm.
when we travel, we say, wow, this tastes weird. Well, no, actually, it's natural food that we're not used to eating. And so
That's right.
just allowing ourselves to take that first step towards the progress that we want, I think is key. So, what would you say to that person who says, I cannot get rid of my diabetes. I cannot change my diet. I cannot
Mhm.
change my exercise habits. What's the one thing you would want them to know to help them understand that they can take that step?
Well, I think you have to be able to look in the mirror, give yourself some grace first, because there are challenges we face. And the morning of this recording, I normally would have worked out with my trainer. I train with a young lady twice a week. I didn't train because I'm recovering from a cold, right? This is probably the first day I've ever canceled, but I bring it up to say, Dr. Hampton needs a trainer. Why? Because I need somebody to be accountable to. I need somebody who is going to keep me on point and motivate me as well and push me. Maybe she'll push me. She has me doing stuff that I probably wouldn't do by myself. So I think the first part of this conversation is give yourself grace and find ways to achieve your goals, even if you need help, like I did with a coach. I think all of us need coaching, whether it's dietary. Most of my patients, I'm encouraging them to have coaching because I think that's a big part of your success. One part of it is knowledge and knowing what works, and then the part of it is getting coaching. But fear is often based on perception, the fear because of what's happened, based on my life experience, that I'll never be a person who won't be able to overcome diabetes. That's not reality, that's fear. It's not reality because we have too many examples of success. So, and it comes from assumptions, and some of those assumptions come from your doctor. Most doctors don't believe that you can put diabetes into remission. They think it's a chronic progressive disease. That's what we were taught in medical school. That's just not true. And I had to learn myself that that wasn't true. And then I had to see examples of that. And by doing that, instead of magnifying the the untruth, the lie, I was able to magnify the truth, which is that this is really the right way to proceed. It's a dietary disease, particularly type 2. Now, type 1, my wife has type 1. And why is her A1Cs in a very good range? Not the American Diabetes Association goals of 7.0, but why is it more like 5.6? And that comes from you can't keep chasing spikes. If you keep eating the foods that spike your sugar and you're trying to match it with insulin, you'll never match it because the label, you're allowed to be off by 20%. If you look at a label, Cheerios or something like that, if it tells you it's 28 carbs and then you're matching the insulin for that, is it really 28 carbs? They're allowed to be off by 20%. So is it 32 or is it 24? And if you don't match the insulin may make your sugar go down too low or make it go too high. And now when it goes too low, now you got to put more sugar in your body. So, but if you ate a meal, an egg omelet that's only four carbs, okay, maybe it's not four, maybe it's three, maybe it's, two, maybe it's six, but you're not going to need a lot of insulin to match that. Therefore, the chances that you'll become hyper or hypoglycemic is very low. So that's part of that knowledge piece. And then if people hear, oh, this is a possibility. Oh, by the way, you also have to think about the protein. Doctors are not taught to focus on protein when they're giving insulin. Well, guess what? Protein spikes your sugar too. So why are we not talking about that? So, but you won't give it right at the meal. You have to do it a little bit later because that spike occurs later. So there's a lot of gaps in the knowledge that are given to the clinicians and certainly to the patients. And my job is to help bridge those gaps, remove the fear so that we can do these things safely. In fact, the fear is why we don't try to get an A1C to 5.6. It was the studies from the past, the Accord studies, the VA diabetes study. These studies from the past said that if you tightly control your blood sugar, it's going to increase your risk for heart disease and stroke. Well, we later learned that it was the high insulin that we were giving people that was increasing their risk. It wasn't the fact that the A1C was lower. So we have to change this old paradigm. And to do that, it's going to require a lot of time, effort, energy. I was just at the USDA a few weeks ago before this recording, trying to spread the message about the fact that the dietary guidelines are not really serving us. And by the way, just for the audience, the dietary guidelines that are given are for healthy people, but only 7% of the population is metabolically healthy. And by the way, the guidelines are given to the nursing homes. They're given to the hospitals. So they're not for healthy people, but we're giving it to healthy people. I mean, unhealthy people. You know what I mean? It's not for, it's not for unhealthy people. So I just think we have to do better. And some of that is to challenge the authorities that we have to do better. And hopefully we'll get there. It's just going to take a lot of effort and fight. And we have something called metabolicrevolution.org where we're, fighting this message. And then we also created the American Diabetes Society, which is an opportunity for us to focus on nutrition instead of medicine as a way to deal with this epidemic. So I'm really excited about both of those.
Awesome. Well, first, I want to just tell you thank you for providing patients with care and knowledge. I know firsthand from being in the room with physicians side by side previously that the work that you do, it's a lot. I remember chasing some physicians down for medical records that they took home to chart back in the day, before HIPAA, right? Where they took the charts home because they were
That's
gonna,
right.
in good faith, try to document over dinner. But I know firsthand that the work that you do is not as rewarding as people think.
Hmm.
There are so many physicians that are leaving medicine. I
Hmm.
personally have had three
Mm.
PCPs in the last 5 years,
Wow.
which has been very scary. But I am a firm believer of having a PCP, primary care physician, because you have to have, that relationship established from the perspective of your history, all the things. And so I really want to just say thank you. Um, from a healthcare leader in a system that is very fragmented, that could be very harsh, especially as an African American physician, a male. I want to say thank you for the work that you do. I appreciate you, even if some days it's rough.
Yeah.
So we can talk about that for weeks and put that in the book. But
That's right.
what's next for Dr. Hampton? I know you're out lobbying and doing those
Yeah.
things, but what next? You got another book coming out?
All the above. So I do hope to go from a diabetes book to an obesity book, which will be my project for 2025. So that's definitely part of it. My leadership roles will probably evolve. I'm kind of the primary care leader for the South Side of Chicago for Advocate Health. I'll probably do a little bit more than that because we're moving towards a model where we want to move towards more of an ambulatory model, meaning ambulatory in the clinic where we help people heal and reverse disease, which will then reduce the need for being in the hospital. People are very cynical about healthcare because they think we're all about, get people in those beds so we can make money. Ultimately, a better model is a model where we, like they do in some European countries where they have more universal coverage and they really have to do this, where we are rewarded for keeping you healthy. So if I have a patient, we actually get paid more money if you have diabetes with retinopathy, diabetes with neuropathy, diabetes with kidney failure, we get paid more money because it is a more complex patient. How about if we reward doctors for taking people off medicine? Wouldn't that be better? How about if we reward doctors for keeping people out of the hospital? So that's the model that our health system, I'm proud to announce, will be moving towards, particularly on the south side of Chicago. And with that model, people will look at us a little differently. I helped to start a food pharmacy where we grow food. We have a smart farm where we grow food, and I have a food pharmacy where we distribute food. That was a vision of mine that I was fortunate to have a health system agree to that. How about if we take it to the next level and we actually have some buildings where we actually grow indoors some of the food indoors? And that'll make it more sustainable because you don't have to worry about the weather and things like that. And then we help feed the communities that we serve. So for me, it's about helping my health system move into this more sustainable model, root cause of disease model, healing model, as opposed to managing disease with, medicines, surgeries, and procedures. So I'll continue my YouTube channel where I have my podcast and my video shorts, and I will continue to spread this word in as many spaces as possible because I think that that's what's going to be necessary to get this message out. So I'm excited. I have a link tree, Dr. Tony Hampton link tree, where they can find links to all the work I'm doing.
I love it. Well, I'm excited to see what happens next. I said for 2025 and beyond, I'm thinking I want to get more involved with research studies. Got to do something with this PhD. It's been about 12, 15 years. Need to do something with
Yeah,
it.
yeah,
But I think I bring a diverse perspective because I work on the side where we're gathering the data. Like we
that's
want
right.
a better collection of social determinants of health, right? So we
That's
want to
right.
get that data into the system because it's needed so that we can figure out how to treat patients better.
That's right. That's right.
So I have to see, I had to pray about it, cry about it, all the things that I did in my bedroom in my ECMO like state. I'm not going to let go of that. It's a part of me now. So
And
thank
please
you.
do that. I'm just going to say this. I'm going to tell you why, because everything I just mentioned with the health system, I am absolutely going to try to couple it with research. Because in order to get other health systems and the country to do this work, they have to see proof of concept. So if I'm going to convince my colleagues like yourself that this works, we need to show the data. And yes, I do think that diversity, equity, and inclusion is important because it brings to the table perspectives that would have not been at the table. And it's really just about equity, making sure people have equal access. I mentioned Inglewood. My kids have a different perspective than the kid in Inglewood, where the life expectancy is 60 years versus Streeterville, which is 9 months away from that in downtown Chicago, which is 90 years. So we want to make sure that the person who has a 60-year life expectation has opportunities. And it's not about, taking away from others to give them. It's just about recognizing they have barriers. They have chronic stress because they're listening to gunshots and ambulances and single moms trying to raise kids. And is there anything we can do, like a food pharmacy, to make life easier? And by doing that, the world's a better place. So that's the perspective I have, and I hope that we continue to message that throughout. So I appreciate that from you.
Oh, I love it. And it just hit me. There's this study that talks about zip codes, right?
Mm.
And it matters where you live, right?
It
My
matters.
grandfather in a week will be 104 years old. But he is not, right, the typical patient in some areas
That's
because
right.
they don't have access to the resources, but also knowledge about access to the
That's right.
resources,
That's right. That's
right?
right.
So it's this um huge pot of resources
That's
that they
right.
don't have, that if
That's
they
right.
had them, you know how they say my people perish for lack of knowledge?
That's right.
That's what's happening.
It's our responsibility as a health system, as a doctor, as a clinician, to make sure they know what the resources are. So we need to learn what you don't have to, I don't, the Chicago Food Depository, which partnered with us to bring food, and now we grow our own food as well. I don't have to be the Chicago Food Depository, but I need to know they exist. I need to know where they are in the community so patients don't know how to get to that resource. And that's really our job. So we can't point our fingers at people because we're meeting them where they are. It's our job as clinicians to say if people are not successful in this healing that we're trying to provide, what are the barriers and how can we support that? As opposed to saying they don't care, they're not motivated. Do you know anybody that's not motivated to be healthy? I haven't met that person. So let's just help them. And then that's the world we want to live in. And that way, everybody wins, everybody benefits.
I love it. Well, I want to thank you so much again for the work that you do. Thank you for coming on, being a part of our December 2024 52 Authors, 52 Weeks, where coincidentally, you are MD number 3 for December.
Oh,
So we've had
wow.
some great physicians
Nice.
that have come on. I have a special place in my heart for physicians. I tell everybody all the time, if you mess with the physician, I am coming for you because I know firsthand the work that you do and how hard it is. And so
Yeah.
I need you all to be around to do the work.
Thank you. Thank you so much for the opportunity.
Thank you.